Dr. Manohar.
Yes, sir. So, good afternoon, everyone. Welcome to the fourth webinar of the five webinar series being
आवाज
conducted.
नहीं आ रहा है.
Hello, can you hear me, sir? Can you hear me?
Yes, Manohar. Yeah.
So, welcome.
Dr.
And
Manohar.
good afternoon, everyone. Good afternoon, everyone. Third webinar in the series of five webinar
the fourth
series
webinar
being conducted
the
on
five
occasion
webinar
of the
series being
Ayurveda Day
conducted.
आवाज नहीं आ
celebration.
रहा है.
Hello, can you hear me, sir? Can someone mute?
Yes,
there?
Manohar.
So before going to
Yeah.
start the webinar, I want to request all the participants to please be muted. And after the end of the guest lecture, there will be a question and answer session. And meanwhile, you can, while during the lecture, if you have any questions, please be posted in the chat box. And these questions will be taken after the session and will be addressed by the guest speaker. So going to the webinar again, I request our Institute Head Dr. R. Govind Reddy sir to give the welcome address for today's webinar. Over to you, sir.
Yeah. Thank you, Dr. Manohar. Om Dhanvantaraya Namaha. Very good afternoon to all. A warm welcome to all the participants. So first of all, I am very glad to say that this is the fourth webinar of integrative oncology. So first three, it was well done. So first, there's a lot of participants. Like in the first webinar, more than 1,300 participants participated. For this, and even second and third is more than 1,100, and today is also more than 1,050 participants registered for this program. And my sincere thanks and gratitude to the Honorable DG sir and DDG sir for the giving.
Sir, please unmute. Please unmute.
I'm very thankful to and gratitude to my Honorable DG sir and DDG sir for giving the opportunity to conduct this webinar series of integrative oncology. And one conference is also there on 19th. And we are doing a lot of work in the integrative oncology. We have started this institute with mandate for the for since 13 years by Ministry of Ayush, and we have the very good OPD and IPDs of the special OPD for the cancer and even breast cancer screening programs. So we have the collaboration with the TMC at track and many institutions we are collaboration, and more than 20 institutions we are collaborated institute with my institution, and we got the COE also, Center of Excellence for Cancer this year. So with the efforts of the my technical officer Dr. Manohar Gundeti and Vikram Gota, and even directors of the TMC Dr. Pankaj Chaturvedi ji and Dr. Gupta ji. And we are doing a lot of clinical trials with the TMC, like ovarian cancer and Prakruti, and even mechanistic studies. My one of the technical officer, Dr. Dattadre, they get involved in the mechanistic studies and even in vitro, in vivo studies also there. And there's a lot of again projects is there, and even we have screened the anti-potential cancer drugs. So and that is published in the by CCRS, and there is a book is available. And so recently we already started since 2 years of the joint clinics, and recently Honorable Secretary has inaugurated the Ayush clinic at track. And with this by these words, without wasting of the time. And so thank you very much to my all technical officers, especially for Dr. Manohar Gundeti for conducting of this program. So thank you very much.
Thank you,
So
sir.
over to you, sir.
Yeah, thank you very much, sir, for your welcome address and the support for this conducting webinar. Uh, it's my privilege to introduce today's speaker, Dr. Kashinath Metri, who is a BMS from Rajiv Gandhi University of Health Science. And after BMS, he did his master's, that is MD in Yoga from Swami Yoga Vivekananda Yoga Anusandhan Samsthan, Bangalore. And later he completed his PhD in Yoga from the same institute in the year 2017. Apart from this, he had various certification courses in the yoga therapy. Currently, he is a, associate professor in the division of yoga and life sciences. Department of yoga at the Central University, Rajasthan. He has a vast experience as a researcher and as an academician. He has completed more than 10 projects in the yoga, and he has guided more than 120 students in their various research projects and published around 50 research articles in the peer-reviewed journals in Ayurveda and yoga as well. He has been an extensive orator in various forums at various conferences and presented his talks on yoga on various aspects. He also conducted various seminars and workshops on Ayurveda and yoga at various places in Rishikesh, in Singapore, in Gujarat, and in Mumbai and others. He has a good, vast, again, clinical experience. He's working as an Ayurveda and yoga therapy consultant. Also, he has experience of treating cardiac disease, pulmonary disease, and mental health problems through yoga and Ayurvedic therapy. Uh, Apart from that, he has various administrative experience at his institute. With this short biodata, I will invite today's speaker, Dr. Kashinath Metri, to start his presentation on the topic, today's topic, that is the role of yoga and meditation in cancer care. Over to you, Dr. Kashinath. Please,
Thank you, sir. Thank
yeah.
you very much. Am I audible, sir?
Yes, yes, please.
Yes. Thank you, sir. At also, thanks to CCRAS for inviting me to talk on yoga and cancer care. And I'm very much impressed about the achievements shared by Dr. Govind. So, in fact, it is a high time that our yoga and Indian traditions has to come forward, and the only way to uh, make it the authentic is through the research. We have to make it evidence based. So that is the responsibility of all of us uh, who are the students of Ayurveda and yoga, I believe. So I will start my presentation. I will share my slides. Uh, is my slides visible, sir?
Yes, please make the full screen. Yeah,
Yes.
yes, perfect. This is perfect.
I welcome you all to this presentation on role of yoga and meditation in cancer care. It is an evidence base. We all are doctors and we know we have seen patients through cancer is a second leading cause of the death worldwide. First, the cardiovascular disease. The most common cancers, what we see in our clinics, they are the lung cancer. Breast cancer is the most common among females, and colorectal cancer and prostate cancer. Now, thanks to modern medicine, medicine that it has advanced to such an extent that we are able to diagnose the cancer in earlier stages, and there are very effective treatments available. If you just go back 50 years back, cancer is an alternative term for death. But now it is no more. So it is through through the conventional medicine that we are able to uh, we are able to treat the cancer by diagnosing it in a very early stage. That has significantly increased the survival rates of the patients and the various types. So, what type of the tumor it is. So, definitely, the natural medicine helped them to increase the survival rate. And in fact, if it is diagnosed in an earlier stage, it can be very easily cured also. Now, interesting thing is, despite there is an advancement in the conventional medicine, when we look at incidences and prevalence of cancer in last 15 years, it is consistently increasing. So uh, in 2012, there were 8.2 million people died with cancer. In 2018, it is 9.6. So the new cases of the cancer and the people die with the cancer, they are consistently increasing. So this shows some lacuna, there is some gap in the cancer care. Now that gap is because we have not understood the cause of the cancer. Unfortunately, modern medicine focus on the treatment aspect when actually cancer happens. And of course, it is very effective. That helps to overcome the disease and the symptoms, and there is a increased survival rate and all that. But in order to prevent that, we have to see the cause of the disease. So the cause of the cancer, the most common cause of the cancer, we say that is a genetic predisposition, environmental factors. So combination of both of these leads to cancer. Now, some of these are non-modifiable factors and some are modifiable factors. Gender, age, family history, genetic mutation tendency, all these are the non-modifiable factors. So we have less to do with them. But very important is there are a lot of things that are under our control which can be modified, and cancer can be prevented through prevention of the risk factors of the cancer, like tobacco use, alcohol consumption, physical inactivity, obesity, unhealthy diet. So many patients we see, so we relate that cause of the cancer is smoking or excess exposure to sunlight, alcohol, and all that we talk. But when we see patients, especially in the rural areas, so they never spoke, they never consumed alcohol, they are physically active, but yet they are diagnosed with the breast cancer. So what is there? So that is where the role of lifestyle plays in. So our lifestyle is unhealthy, especially our diet is unhealthy. So that is where the very important cause of cancer resides. Now, what are the current challenges in the cancer care? So, thanks to conventional medicine that has greatly contributed in treating the cancer in early stages, that has helped us to uh, uh, overcome these symptoms and prolong the lifespan of the cancer patient. But unfortunately, the challenges still exist. Though there are treatments like chemotherapy, radiotherapy, surgery, so that there is a lot of advancement in chemotherapy also. So earlier, the side effects of the cancer treatments very high. In fact, patient used to that I will choose to die instead of taking the cancer treatment. So that was the condition. So the side effects were terrible. But fortunately, there is an advance in the cancer treatment. The side effects nowadays are less compared to previous. But there are still side effects. Okay? There are side effects still. There are major challenges. The other major challenges is the symptoms. So most common symptoms is a fatigue, ongoing inflammation. That challenge is still there, which cannot be addressed through the conventional medicine. So there is some lack in the current management of the cancer. Very importantly, psychosocial consequences of the cancer. So cancer not only affect a particular organ, it's not only affect the body. So the cancer effects are more pronounced in the other aspects of the life, like psychosocial health. So cancer, significant number of patients who are suffering from cancer experience stress, anxiety, depression. The cognitive impairments, call it as a chemo brain, significant impairment in the attention, memory, loss of concentration, poor body image, and role change. So earlier, the patient was a very active member of the family. He was the resource of the family. Now suddenly he becomes the dependent of the family, and there's a lot of burden. So, so this makes a very significant impact on the person's feelings, person's overall health also, and the financial issues. Unfortunately, the cancer treatment is still expensive, which cannot be affordable by the poor. Thanks to the governments of different states, they are providing a lot of financial aid for the cancer treatments nowadays. But we have a long way to go in that. And the other important thing is the cancer recurrence. So most of the patient, they get cancer and get treatments, and they come out of the cancer, and unfortunately again they go back to the same lifestyle, and again they get the cancer uh, next phase of life. So cancer recurrence has become a very important challenge in the care. Then lack of effective preventive measures. We are working on cancer patient. Unfortunately, we don't have any interventions that can help to prevent the cancers. That's very important to set it. So these are the challenges what we are having currently in the cancer care. Now these challenges are not only just the challenges on their own. So they have a significant impact on the cancer patient. Not only cancer patient, in fact, cancer treatment. So psychopathology is like a patient. If a patient having cancer experiences mental distress, if he is having anxiety, if he is having a stress, if he experiences depression, that significantly impact various stages of the cancer. First of all, the diagnosis. So during diagnosis, if the patient is if patient is having a weak willpower, or if he has a stress, anxiety, depression, that leads to poor acceptance. That leads to faster progress of the cancer. So if we compare a patient who is having the two cancer patients, one is having the cancer with anxiety, the other patient is having cancer but no anxiety or no stress. The cancer progression in the patient having the mental psychopathologies, cancer progress will be faster compared to the other patient, and increase the suicidal risk. So the suicidal tendency among the cancer patient is very high. Of course, the anxiety, stress, depression, all that, the diagnosis of the cancer. In fact, this becomes very challenging. Patient having these issues becomes very challenging to treat the condition and to treat the patient. Now, during the treatment, the psychopathologist found like a low treatment tolerance. So chemotherapy, radiotherapy, when patient are undergoing. So if a patient is very anxious, the patient is very much distressed, will have a more uh, side effects of the chemotherapy and radiotherapy, and there is a decreased tolerance to these. Tolerance to treatment decreases, the recovery will be slower, and patient need to stay longer in the hospitals, and he will develop more number of symptoms compared to the patient who are not distressed. And it is very common that patient will suffer from various kinds of mental health issues during the cancer. Then cancer survival. So increased recurrent risk. If the patient is having, if the patient is experiencing a lot of anxiety, stress, depression, all the psychological issues, the cancer survival will increase, and there is an increase of recurrence of the cancer. There is low quality of life. Then the residual symptoms of the cancer will also remain longer. So these are and the medication side effects. Now we understand what is the role of the yoga. So how yoga can play a vital role in and fill the gap what is existing in the cancer. So when we say yoga, yoga is not just asana, it's not a pranayama or just meditation. Of course, they all are the part of the yoga discipline, but yoga is more about the lifestyle. So there are various components of yoga like yama, uh, all those components are there essentially indicates the lifestyle. So we have to focus on the lifestyle aspect of the yoga. So there is a beautiful quotation from Bhagavad Gita. It says, "Yuktahara viharasya yukta chestasya karmasu yukta bodhasya yogo bhavati dukkha." The yoga lifestyle, which is characterized by moderation in the diet, moderation in the sleep, moderation in the activity, is potential enough that can help you to overcome all sorts of dukkhas in this life. So all pain can be eradicated through the practice of yoga, through the practice of moderation in the lifestyle. So it has yama, niyam, asana, pranayama, pratyahara, dharana, dhyana. So that ultimately reaches to the state of samadhi. Okay. So now we talk about asana, yama, niyama, and all those aspects, but uh, currently the perception about yoga is just asana, pranayama, and meditation, unfortunately. But anyway, so there are a lot of research being done taking only these aspects of yoga and found they are very, very effective. Okay, so even a person practices asana, pranayama, and meditation. That brings immense change in the body, immense change in the perception, immense change in the mind. Now let us understand the cancer from the yogic perspective. So how yoga looks at cancer. So what is so there is no exact mention about the cancer in the yoga text, but so in general, so there is a one beautiful text is Yoga Vasishtha. So Yoga Vasishtha says so there is a Vyadhi. So Yoga Vasishtha classifies Vyadhi into two types: Adhisha Vyadhi and Anadhisha Vyadhi. So Adhisha Vyadhi. So in the Adhisha Vyadhi, Adi is a very important term. It's Adi, Avarnat iti Adi. That which clouds our intellect, that which reduces our willpower, that which takes away our memory, our intelligence, and makes us to follow unhealthy lifestyle, makes us to follow the wrong things in our life. In fact, the Bhagavad Gita says, Mana eva shanam karanam bandha moksha. It is the mind that determines the person will be happy or he will be unhappy. It is the mind that person that decides that person will grow or he will have a downfall in his life. So mind has given a very importance in our ancient scriptures. So what is Adi? Avarnat Dhi Iti Adi. So that covers our intelligence, that covers our buddhi, that covers our power is called as Adi. Now we have to understand.
Sir, sorry to disturb you. Your screen is not visible, sir.
Sorry.
Please share your screen once.
Yeah. Now is visible, sir.
Yes, it is visible now. Yes, it is visible.
Yes. Right.
Thank you.
So what is Adi? Adi is a deep-rooted psychological patterns, which in yoga we call it as a vrittis, kleshas, shadripus. So all those emotions, negative thoughts in the manomosha, in the mind, okay, so they are the adhis. Now, adhija vyadhi is the disorders which are born because of the presence of these kleshas, because of the presence of the vrittis, because of the presence of the shadripus, kama, krodha, lobha, moha, matha, matsarya, in the manomosha, in the mind, they are called as the adhija vyadhi. Okay. Now, cancer is one of Adhija Vyadhis. Now, how it comes, how we can relate that, how cancer can be caused by the. My screen is visible, sir?
No, no. Again, it has stopped sharing. Please share your screen.
This is the continuous region of groundwater, which is on. Yes. It's visible, sir, now?
No, no, not yet.
Not yet. So,
Should I share from my side, sir?
yeah, that's also okay, sir. Now,
No, no, not visible.
yes, sir, please.
Okay, then I will share on my side. Can you see the screen, sir?
Yes, sir, we can see your screen.
Okay, this is the slide you were talking about.
See the slide that here it is showing some customize your stage review something.
This one or this one?
I'm unable to see this slide.
You are not unable to see the screen?
Yes, sir. And now I can see this screen only.
Let me share once again.
Can you see my screen, sir, now?
It's blank, sir. It is blank.
Others also unable to see.
Can you see, sir, screen?
Yeah, yeah. Now I can see.
Yes, sir. Please go ahead. Please go ahead.
Yeah, yeah. Thank you, sir.
You just
So
let me
clouded,
know when move to the scheme. Okay.
yes, sir, yes. Uh, so what is Adi? Adi is a clouded intellect. So poor determination. So most of us we know that what is right and what is wrong, isn't it? So everyone knows that we should get up early in the morning. Everyone knows that we should behave nicely. Everyone knows that we should eat healthy diet and we should not eat food outside, isn't it? But unfortunately, very few, maybe 1 to 2% people follow that, and 98% people fail to follow that. Now, why they are failed to follow is nothing but it is through the kleshas. It is because of the vrittis. It is because of the shadripus in the manomaya kosha. So when we have the psychological tendencies, raga, dvesha, avidya, vinivesha, all that in our manomaya kosha, that actually resist us to follow the healthy lifestyle. And in fact, that insist us to follow unhealthy lifestyle. So ultimately, we lead an unhealthy lifestyle, and the consequence of that is the chronic disorders. Similarly, what we saw the causes of the cancer is the unhealthy lifestyle. So that aspect of the cause of the cancer is because of the adi which is exists in the manomaya kosha. Okay. Next, sir. No, no. Before that. No, one slide before that, sir. Go back. Ah, yes. Now, when we follow unhealthy lifestyle, that ultimately leads to a lot of changes in our body physiology. So when we consume unhealthy diet, when we don't do physical activity, when we take a lot of stress, when we have a lot of anger, a lot of anxiety, a lot of frustration in our mind, that ultimately makes the that ultimately brings the negative change or negativity in our physiology that leads to chronic inflammation. As we know that chronic inflammation is one of the most important pathophysiology in the development of the cancer. Okay. So that leads to chronic inflammation. So in fact, there are a lot of research being done, and that what it shows is consuming unhealthy diet, consuming excess consuming refined oil, consuming refined sugar, that leads to chronic inflammation in the body. In fact, having a lot of anxiety, having a lot of stress, chronic stress leads to inflammation in the body. So ultimately, our unhealthy lifestyle causes the chronic inflammation in the body. And there is a HPA axis dysregulation, hypothalamic pituitary adrenal axis dysregulation. There is an autonomic imbalance. There is a increased sympathetic activity, and there is reduction in the parasympathetic activity. Dysbiosis. So in our gut microbiota, so there are more of negative bacteria, unhealthy bacteria, and less healthy bacteria. Similarly, abnormal immune response and there is genetic mutation, and there is a increased oncogenes, and there is a development of the cancer. So this is how the uh, yoga perceives that it is a adi that leads to the unhealthy lifestyle, and the unhealthy lifestyle ultimately lead us to the cause of the cancer. Next. Next. Yes, sir. Sorry, it is not visible here, but the definition of yoga, when we see the definition of yoga, according to Patanjali, it is yoga chitta vritti nirodha. See the definition of yoga. So what we told before is adi. Adi is nothing but the vrittis. Vrittis in the chitta. Now what is yoga? Yoga is that discipline which removes the vrittis in the mind, which removes the vrittis from the mind, which removes the kleshas, avidya, asmita, raga, dvesha, abhinivesha, which are pancha kleshas in our manomaya kosha, which are actually the cause of the unhealthy lifestyle and ultimately leading to chronic disorders. They exist in our manomaya kosha, and yoga is a discipline, yoga is a technique that helps to eradicate all those kleshas. Similarly, one more definition from Yoga Vasishta says Mana Prashamanopayu Yoga. Similarly, Bhagavad Gita says Samatvam Yoga Uchyate. So all these definitions are related to mind. So yoga is not about asana or pranayama or meditation. It is all about the mind. It is all about the purification of the mind, removing the negativity from the mind. So once the mind is purified, when there is a chitta prasadana, that means chitta shuddhi happens, ultimately the clarity comes, ultimately the realization happens, ultimately we lead a healthy lifestyle, and ultimately the risk of all sort of disorders also nullified. Next slide. Next slides. Yeah. Now, health benefits of yoga. So there are a lot of research. So these statements are based on the researchers. So a lot of research what shows is yoga has an impact on each and every organ of the body. Okay. So yoga helps. So practice of Surya Namaskara, practice of asana help to strengthen the muscle, help to increase the muscle endurance and the stamina, body stamina. It increases flexibility and exercise capacity. In fact, it is a cardiopulmonary function get enhanced when we practice. Similarly, neuropsychiatric benefits of yoga includes increased GABA level, serotonin level, melatonin, which are the neurohormones, which are very important for the normal functioning of the brain. So there are a lot of research being done, and what it shows is yoga has a significant impact, positive impact on these neurohormones also. It reduces sympathetic overactivity and increase the parasympathetic activity. So a lot of chronic disorders, they are characterized by increased sympathetic activity and decreased parasympathetic activity. So what yoga does is it increases the parasympathetic activity and helps to reduce the sympathetic activity. Thus, it brings the it gives a deep rest to our lot of body system like cardiovascular system, nervous system, respiratory system, and all that. It helps to decrease the cortisols and catecholamines. In fact, most of the disorders, including the cancer. So cortisol is one of the very important mediator that actually increase the risk of the cancer development. And yoga is having an anti-inflammatory and anti-aging property. Next. Yes, yoga in cancer. So a lot of research is being done in cancer, and what they all found is yoga is a very safe, feasible, non-pharmacological intervention for cancer. So active involvement of participants. So yoga, it's not just the patient has to just lie down and something will happen. So the participant has to engage themselves actively into the yoga practice, and that motivates them and that makes them that they are contributing to their health. Okay. So it can be very uh, very safely practiced during the cancer treatment also. Like a patient, if they are receiving chemotherapy, they are bad even in lying down position. There are a lot of yoga interventions like simple meditation. They can just lie down, close their eyes, and chant Omkara. So even that can be very easily done. It's a very easy and user friendly. It improves the mental quality of life among the cancer patients. In fact, there are a lot of research being done. I will share some of the researchers here. Next slide, sir. Yes. So these are the various stages of the cancer where yoga is very, very effective. Right from the diagnosis, when the diagnosis happens, the patient, it is actually a trauma to the patient. In fact, that causes a lot of stress, anxiety, and depression to the patients. In such condition, when patient practices yoga, that boosts their resilience, that helps to reduce their stress, anxiety, and depression. And in fact, that motivates to cope with the ongoing stress after the cancer diagnosis. It improves the sleep. Sleep is one of the very important aspect that get affected because of the cancer. In fact, the cancer patient who sleep less or who have a sleep issues, they have a faster progression of the cancer, and they tolerate they have poor tolerance to the cancer treatment also. And during treatment, there are a lot of research during the chemoradiotherapy treatment. Practice of cancer helps to reduce the uh, chemoradiotherapy side effects like vomiting, nausea. Very important is the fatigue and sleep quality. Then post survival reduce the medication side effects, fatigue. It reduces the recurrence of the cancer because I'm going to share a few of the very important research studies where you will understand how yoga can help in reducing the risk of the cancer recurrence. Next. Yes, this is very important study, very recently done by Dr. Rima Dada from AIMS, New Delhi. So what they found is they studied the parents, they study the fathers of the child who had a cancer. What they found is there's they did their sperm analysis. Semen analysis, they saw the sperm quality. So what they found is the fathers of these cancer uh, children, they had a high oxidative stress in their uh, in their sperm. Okay, so there is a oxidative DNA damage is also present in the sperm, and there are a lot of issues with this. So such patients, they are given yoga for 6 months, and after 6 months, they found significant reduction in the oxidative stress, and there was a reduction in the oxidative DNA damage, and there is increased telomere length. So all this shows that yoga has a potential to prevent the cancer. So, what this particular study said is uh, like those who are planning for the children. Okay, so if they are aged, if they are above 25, all of them they should practice yoga. They should make their uh, sperms healthy so that the cancer chances among the children will significantly reduce. So this is what is a very important study, I would say. Next. Yes, sir. Yoga and cancer risk factors. So, as we discussed before, the chronic inflammation is a very important component in the cancer development. So, what yoga does is yoga reduces the inflammation. So, very inflammatory markers such as TNF alpha, interleukin 6. So, these are the two important inflammatory markers which are very strongly associated with the cancer development. Through practice of yoga, TNF alpha and interleukin 6 significantly reduces. Similarly, the oxidative stress is related to the cancer development. Yoga reduces the oxidative stress. There are a lot of studies. Yes, I'm not talking about one particular study. So there are many such studies which have shown that yoga helps to reduce oxidative stress, maintain healthy weight. So obesity is one of the very important risk factor of cancer. So yoga helps.
Sir, unmute yourself. Unmute yourself.
Yes, sir.
Please.
Next slide, sir. Yoga for symptomatic relief. So this is a very important study. This is a meta-analysis study. Okay. So this is a combined conclusion of 7 important studies. So there are 7 randomized controlled trials being conducted, and all these randomized controlled trials, what they found is yoga helps to reduce fatigue, depression, anxiety, and improve sleep quality among cancer patients. Okay. So this is a very important journal Annals of Palliative Medicine. So that publishes this article which shows that this is a meta-analysis study, and yoga is a yoga practice by cancer patient definitely helps them to reduce a very important symptom which is fatigue. Next slide. So similarly, this is another meta-analysis study. So I'm not putting one study. So I'm putting a meta-analysis study. Meta-analysis study is a combination of it is the review of many studies in that particular subject and making the conclusion. It was a systematic review on 26 randomized control trials. Okay. So 26 randomized control trials among 1,544 cancer patients. What it reports is the practice of yoga in cancer helps to reduce anxiety, and it significantly reduces the depression. So anxiety, depression are very important uh, precursors for cancer progression. So if a patient with cancer is having anxiety, depression, so the symptoms will improve, the treatment tolerance will go down, and the chances of recurrence will also be higher, and chances of suicide will also be more. So practice of yoga in such patient will help to prevent all those adverse conditions. Next, yoga for stress reductions. This is again one more meta-analysis study among 24 randomized control trials among 1,887 participants. So all these are the cancer patients, and these are the randomized control trials, which is a gold standard for establishing any evidence. So what this meta-analysis concluded is yoga is a best intervention to reduce the stress among cancer survivors. So stress is directly related to chronic inflammation. So reduction in the stress helps to reduce the inflammation. If there is a reduction in the inflammation, definitely that is going to reduce the cancer progression. Next slide. Similarly, yoga for anxiety and depression. So this is one of the. So here I would like to cite one of our own study, which is we did among breast cancer patients, breast cancer survivors. So there were 30 women. So we did this study on Facebook. So we created a private Facebook group, and these women were international women. So 30 women they participated in this study. So all these women they had a breast cancer, and they survived breast cancer, and currently they were taking the aromatase inhibitors to prevent the recurrence of the cancer. So one of the important side effects of the aromatase inhibitor is the joint pain. Okay. So systemic arthralgia. So what we did is we gave them yoga therapy on Facebook. So every day they used to come and they used to practice yoga, and we used to monitor in the Facebook. So 1 month we gave them and we assessed them 1 month before and after. What we found is there is a significant reduction in the pain. So joint pain gone away. Simple loosening practices of yoga, simple breathing practices. That too sitting in their on their own bed. Okay. So the practice and the pain significantly reduced. In fact, there was swelling in the joints also reduced significantly, and they felt better in their fatigue levels. So earlier they used to feel fatigue. Now the fatigue has significantly reduced. We presented this study in American Clinical Oncology Society conference, and they published the abstract of this article in the Journal of Clinical Oncology, which is having an impact factor of 42. So that is the importance of you. So next slide, please. Yeah. So this is what I wanted to tell, that yoga has a very simple uh, practice to do, and it is very feasible. Cancer patients very easily they adopt it, and starting yoga right from the diagnosis of the cancer will help the patient have a very smooth journey throughout the practice, throughout the cancer treatment. It also reduces the future risk of recurrence of the cancer, and the parents, if they start practice yoga earlier, so before they plan for children, so we can successfully reduce the future risk of developing cancer among the children. So this is what I wanted to share from my end. And if there are any questions, I welcome. Thank you.
Thank you, sir, for your nice illustrative lecture.
Thank you, sir.
We request the participants to, if they have any questions, please post in the chat box. And if you want to ask, please unmute yourself, or raise your hand so I can unmute yours to ask the question. So Dr. Hemalata Dubey, she has. Maybe I will stop sharing the screen now.
Yes.
So before that, sir, one question is there. Why the Jaiprakash Ram is asking, when air, water, food all are polluted and toxic, how is it possible to manage cancer with any modality of treatment? In the name of immunity improver, tamasic foods like eggs, non-veg, etc. are prescribed to patients, and even the chemotherapy drugs are toxic. Then having so many toxic tamasic materials in body, uh, is there any scope for yoga?
Yes. So very good question. In fact, very much relevant. We all have experienced that. In fact, there is a lot of pollution. There is a lot of pollution, air pollution, soil pollution. Of course, in fact, we have to work on that. In fact, there are a lot of government schemes. In fact, government is also now emphasizing more on the organic farming and all that. But we have a long way to go there. So before that, what we have to what we have to see importance here is again the mindset. Okay. So we have to have that mindset. So we have to be broader. We don't have to just think of ourselves. So what is the cause of this pollution, water pollution, air pollution, or soil pollution? Is a greed in the mind. Okay? So we have to earn more. So there is no better clarity. That is what yoga is talking about. So in yoga, it is a survey bhuvantu sukhinaha, isn't it? So our ancient scripture, our ancient sages like Patanjali, like Shushruta, like Charaka, so they were of that mentality. So when we develop such mentality, definitely we are going to eliminate all these pollutions and all, because we are working for others, we are working for society. So when there is a lot of negativity in the mind, we become selfish, and again we just use the nature and we spoil it. Now when we have that clarity, we love the nature and we nurture it. In fact, we have seen many yogis practice yoga, who live the life of yoga. They love nature. In fact, you yourself can see the people around you. In fact, I have seen many people who were not so sensible. When they started practicing yoga, they become sensible. They start sensing the people around them. they start sensing the nature around them. But here I would like to put one example. So there were so one couple, they came to us, and they were in their 60s. So they were fighting. So they used to fight every day. Okay. So they came here, and we were talking to them. And the husband says that I have a hypertension. My blood pressure is not under control. And the cause of my hypertension is my wife. So you don't counsel me anything. You counsel her. You tell her that she should do what I say, and she should not argue with me and all that. So similar case was with her also. She was also sick. She was having diabetes, and he was having diabetes. So they stayed there. They stayed there for 21 days. And after that, they gone to their native, and they were continuously practicing yoga. So after 6 months, they again came back to our campus for refreshing the practice. So this time there was a drastic change. So this time the same husband, he said that it was my myth, it was my misunderstanding, that earlier I used to say that my wife was the cause for my hypertension. Now I realize it's not my wife, it is me who is the cause of my hypertension. In fact, I am the cause of her diabetes. So our sugar level goes up when I become angry. So now I have understood. Now I have developed compassion for her. Now I started loving her. So this is what is the sensitivity is the issue. When we become sensible, then we start loving the nature. We start loving water. We start loving soil. We start loving air. Then all these pollution issues will. And when we start practicing yoga, our mindset changes. It's not that willingly we are doing it. So you develop such mindset. I have seen many patients come to yoga. Earlier, they were like hardcore non-vegetarians. After practicing yoga for 6 months, they started hating non-veg. They started loving simple diet like khichdi, like simple boiled vegetables, which was very much difficult for them to consume before. So instead of thinking, I believe that we should start doing yoga, we should start practicing it, then we should be able to see the change. This is what I would like to say.
Okay. So the next question is that Dr. Hemalata, she raised her hand, but also she typed the question. Namaste, sir. Are there any specific asanas mentioned for different type of cancer during your case studies?
Yes, sir. In our case study, it was the Sukshma Vyayama. Okay. As these patients, they were having a lot of joint pain. Every joint had a pain and swelling. So they were not able to do any asana, or even practice of pranayama was also very much difficult. What we gave is simple, like they have to just move their fingers, they have to bend their wrist and ankle, and that they have to synchronize with the breathing. Okay? And after that, they have to close their eyes, they have to chant, isn't it? So they have to chant Omkara, they have to listen to music. So all that very simple practices. In fact, we have to we have to tailor the yoga module depending on the patient's capacity. So that varies case to case. Yes.
Okay.
Yes,
So
sir.
Dr. Priyanka Singh is asking, what would be the minimum or maximum duration for which yoga intervention can be given while conducting clinical trials to get the statistical significant results? This is one question, and there is another question the same. IL-6 and TNF alpha markers will work for any type of clinical trials on yoga, or there any specific marker that should be selected as per disease or conditions being studied?
Yes. For first question, what is my experience and in my research practices, like we advise minimum 3 months of yoga intervention. So when we do 3 months of yoga intervention, what we generally have observed is that makes a significant impact on each and every body physiology or body function, so that we can see the pronounced results. So I would suggest like minimum 3 months of yoga intervention we all should plan. And the other question is interleukin 6 and TNF alpha is not for all things. So it's not a disease. It is a inflammatory markers. So any disease in which you want to see the whether there is a reduction in the inflammation or not. So you can use these inflammatory markers. But when we are studying yoga interventions or even for Ayurveda, so these markers has to be disease specific. So if you are doing on diabetes, blood glucose level. If you are doing for hypertension, there should be blood pressure. And interleukin, TNF alpha, all those things, they are the markers of the inflammation. So they can be used in any disorders if you are interested in the inflammation. So other conditions for other clinical conditions, the that particular disease specific marker and inflammatory marker that both can be done.
Okay. And the next question, Dr. Priyanka Baravkar is asking, how can yoga be adopted for patients with limited mobility or severe fatigue?
Yeah, this is what I was telling that yoga model has to be tailored as per the need of the patient. So if the patient is having a severe fatigue and he is not able to move from the bed, and so there are simple meditation practices. There is something called mind sound resonance technique, which is around 45 minutes yoga session, where patient will just lie down on the bed and they will chant. Okay, so chanting of Akar, Ukar, Makar, and Mahamrityunjaya mantra, and feeling the vibrations of those mantras within. Okay. So such things can be practiced, or even in lying down position, simple abdominal breathing. Or so we have the Vibhagiya pranayama, where sectional breathing, simple loosening practices, joint mobility. Okay, chanting, breathing practices, joint mobility. These will definitely help to reduce even fatigue also. Yes, sir.
There is another question is that what training or certification should yoga therapists have to work safely with cancer patients?
Nowadays, in fact, there are some basic yoga certification courses, like 1 month, like 2 month, which will help you to understand the basics of yoga, and that will equip you with the so that you can teach yoga to others. But when it comes to disease like cancer, so you have to thoroughly undergo a very specific training. Okay. So there are a lot of centers, lot of hospitals where there are certification course particularly for a particular disease condition, even for cancer also. So like in SVSI University Bangalore, there are certification courses for cancer therapist. So for if there are disorders and you want to treat the disorders, you have to undergo the long-term teaching plans, and you have to have a very specific certification courses for that. So general yoga learning will not help in uh, helping the patients with cancer.
Okay. Dr. Guru Siddheshwar is asking, Namaste, doctor. How does yoga affect the quality of life in patients with stage 3 or 4 cancer undergoing active treatment? And any drawbacks from the yoga regimen?
Definitely, no drawbacks as such. What we observed in our clinical research practice, it definitely help to improve their quality of life. So first of all, patients who are having stage 3, stage 4, and they are also receiving cancer treatment often experience anxiety, often experience depression, isn't it? So they have a lot of sleep issues, isn't it? There is a lot of dependency. There is no talking. There is feeling of isolation. So all those issues will be there, which actually make their quality of life very poor. So in such patient, practice of simple asana, simple pranayama, whatever they can do, isn't it? Simple meditation techniques. In fact, when they are doing it, so they are also having the alliance with the therapist. So somebody is coming to them, they are, and somebody wants to help them, somebody is talking to them. That makes a lot of significant impact. In fact, there are studies which shows that talking therapy. So just they will speak what they're feeling. That makes them feel a lot of comfortable. That reduces their depression. And all. So in yoga there is a lot of things. So it is the same practices as well as interaction with the therapist. All that makes them reduce their stress, anxiety, depression at psychological level. Now these practices help them to improve their physiological functions also. It helps them to it helps them to improve their blood pressure. It helps them to improve their sleep quality, reduces their inflammation. Ultimately, that helps them to reduce the symptoms of the uh, treatment side effects or symptoms of the cancer itself. So this is how they feel. Their well-being will definitely improve, and that enhances their quality.
Yes, thank you. I have posted sir two links. These are related to basically this ASCO guidelines. We mentioned that one of your study has been published in the clinical oncology conference. The
Yes.
American Society for Clinical Oncology, they have published the guidelines for integrative oncology in collaboration with Society of Integrative Oncology. So in the
Yes.
recent guidelines, they have mentioned yoga as one of the part for to reduce the fatigue and depression and anxiety. So I
Yes.
have shared these two links here.
Yes.
Sir, the next question is Dr. Hemlata Dubey is asking, did you use Neti, Tratak and Kapalbhati and found any specific type of cancer? Uh, that's the questions.
It's a benefits, sir. Any
Benefits.
benefits?
Uh,
Yes. Definitely, we avoid Kapalabhati in cancer patients because they are actually having the issue of fatigue. So, any dynamic practices, for that matter, we usually avoid. Okay. So, only simple sectional breathing or Vibhagiya pranayama, Nadi Shuddhi pranayama, Bhramari pranayama, chanting, we give a lot. Okay. Uh, Jalneti Trataka, definitely you can. Okay, it's again depend on the patient. So Jalneti Trataka practice will actually help them. So we don't know exactly whether it is simply a practice which is related to nose and nasal cavity. But what we found is practicing these kriyas improve the patient's willpower a lot. They feel they are great. They are doing something. So I personally I experienced. So this is a very important benefit out of Janneti. What I saw is after doing that they feel their self-esteem boosts. They feel that they are something and they can do it. Okay. So that gives a lot of motivation. So that is what I have found, and we can definitely use unless and until there is a specific contraindication. We can always use Leti and Trataka if they have if they don't have any contraindication. And Kapalbhati, better we avoid in patient if they are having a lot of fatigue issue and all.
so thank you, sir. There are a couple of compliments with the Kiran Mantri. Thank you. And then Parthvi Rathod, she is saying, thank you so much for a wonderful training. Prajna, she has mentioned the thanks to you. To add this audience, I wanted to inform you that Tata Memorial Center, they also started the yoga practice for the public and the patients and caregivers.
Caregivers, yes, sir.
Yeah,
One
even
one
for
important
caregivers,
factor.
that is one of the important, as you mentioned also,
Yes,
because their status of mind is also quite important. So for caregivers and patients, the yoga has been started, and Dr. Barve, he has conducted a large study on yoga in the breast cancer patients, which has been again published in reputed journals. So the interested one can go through. I may share the link for the interested ones. I think, sir, there are no any more questions, but the participants are sending messages like insightful session, nice information. So these are the compliments to you, sir. Thank you very much for
Thank you,
this
sir.
nice, again, illustrative and very lucid lecture. Uh, could you share any contact for referral? Okay, we put Dr. Kashinath Metri's email ID here. Uh, so who are interested, they may contact Dr. Metri directly through his email.
Yes, sir.
I don't see, sir, any more questions here, but uh, seeing the time now, right, so more than 1 hour we are here. So thank you very much for spending time here with us, sharing your knowledge. Is especially very good because the background what you have is Ayurveda and again yoga. Yesterday we had a similar type of a speaker, something unique, like he was modern science trained, MBBS, MD, DNP, and then again he was BMS and MPhil in Ayurveda. So we had a speaker yesterday, and today we have another unique speaker who is having yoga background, Ayurveda background, but he did his master and PhD in yoga. So this is a unique combination that you had. Thank you very much for your sharing this information and experience to all our audience here. We look forward for your support in future our endeavors. Thanks to you from on behalf of CCRS, Ministry of Ayush, and my institute in Mumbai. Thank you very much, sir. And
Thank you,
thanks
sir.
to
Thank
thanks
you
to
for invite. Thank you for inviting me, and it was really a wonderful experience and very enthusiastic participants. I am grateful to CCRAS for inviting me here and giving me this opportunity. And I look forward to have such opportunities in future also. Thank you.
yeah, thanks to all the participants again because they made to happen this and also their presence through their interactions that sense that they were very well within the webinar and I think they have enjoyed it very well. Thanks to that, and thanks to my CCRS headquarter team, the IT team who are behind this to make this session happen, and my colleagues and our institute head at CCRS Mumbai unit. So thank you everyone. See you then again tomorrow. There is another webinar at 3 o'clock. Tomorrow is the fifth webinar. And on 19th, we'll be having one web conference that is at 2:30 to 4:30 p.m. It's a 2 hours, 2 hour long webinar session on 19th. Today evening, we'll be sharing the flyer uh, amongst everyone. And please do register for that event. We look forward for your continuous support. So thank you very much, and good evening. Namaste.
Yes. you.